Sepsis is life-threatening organ dysfunction in the setting of an infection. Now, most infections are not septic, and most patients will do fine with antibiotics. In the beginning, usually the symptoms that a patient experiences has a lot to do with the body part or the organ that's involved in the infection. So for example, a urinary tract infection may give symptoms such as burning with urination, increased urinary frequency, pain in the abdomen, and if the kidneys are involved, pain in the flanks. Now, a pneumonia, which is also a very common infection and mainly viral over bacterial, can present with symptoms such as coughing, may or may not have a sore throat, phlegm or sputum production of various colors, blood may or may not be present, difficulty with breathing, pain with deep breathing, and the like. Cellulitis is another common infection where the skin gets involved, and symptoms include red skin, tender skin, the skin may change, there may be some abscesses or a pustule that drains. So in the beginning, when these infections are treated appropriately, the patient can move on with their life and there aren't any other problems. However, some infections are critical and life-threatening. When the body becomes involved, the first signs that patients will report are fevers or chills, and their bone marrow responds to the infection by increasing the white blood cell count so that the body can fight the infection. But in sepsis, it becomes a whole lot more severe than that. The blood pressure may be affected and it may drop. Your heart rates continue to climb just because of severe dehydrated infectious state. Your kidneys may shut down and hold on to as much fluid as possible due to the concurrent sepsis. Now, your respiratory function may be affected. Now, most people will usually have sepsis and they'll be able to exchange and pick up the oxygen normally. But if you're a patient who has COPD or asthma or any other form of lung disease, a lung infection can also take away your ability to exchange oxygen. Once sepsis is identified in the emergency department, the doctor will immediately start IV fluids, IV antibiotics, and medications to help raise the blood pressure if the blood pressure is too low. In that case, the patient may or may not be admitted to the ICU. And in some severe cases where the patient is struggling to breathe and cannot maintain their airway, they may have to be mechanically ventilated or connected to a life support machine. Sepsis carries an incredibly high mortality risk, which is why it must be identified immediately. Patients who are elderly, more frail, immunocompromised, or have weak immune systems, or have multiple medical conditions may take a little longer to respond to the treatments. Understand that with sepsis being as life-threatening as it is, all your doctors are going to be very concerned about it being present if it is. Follow for more content so you can stay updated about basic medical diseases. Until next time.